People with disabilities face many barriers to good health, wellness, and safety. Multiple studies show that individuals with disabilities are more likely than people without disabilities to report poorer overall health, less access to adequate health care, less support for healthy behavior choices, poorer mental health, less access to healthy food or safe places to sport and play, more often victims of crime, unable to follow emergency evacuation orders, not having necessary supports and resources after a disaster, unable to receive assistance or access emergency services due to inaccessibility, and unable to return to their pre-disaster health status. Health disparities among people with disabilities can be the result of inaccessible facilities and equipment in public health activities and programs or healthcare clinics and hospitals, lack of knowledge among public health and healthcare professionals about disabilities, transportation difficulties, and higher poverty rates for people with disabilities. Accessibility applies to communication, programs, and physical access. Public health practitioners need to be aware of how to develop health promotion materials in accessible formats, develop health interventions with universal access as end goal, and modify program components to meet functional or access needs when necessary. Public health practitioners should also seek to understand differences in those with disabilities and those without disabilities in terms of factors that support healthy or unhealthy behaviors and opportunities and adapt guiding health frameworks accordingly. Health professionals need to be aware of how to effectively communicate with patients who have a range of disabilities, including people who are deaf or hard of hearing, or have a speech, vision, or intellectual disability. Health providers should ensure that accessible medical equipment is available for people with disabilities, such as adjustable exam tables and diagnostic machines, and wheelchair accessible scales. Reliance on the internet and technology to access public health or emergency information, receive emergency warnings and notifications, track disease outbreak progression and case numbers, schedule COVID-19 vaccination or testing appointments, or meet with health professionals via telemedicine, all creates opportunities of increased accessibility for some and barriers to accessibility for others. Websites must meet certain design and layout standards to be accessible to people with various types of disabilities, including those who are blind or have low vision or use screen readers. Videos posted on a department website or social media page must have an accompanied transcript, closed captions, or an ASL interpreter in order to be accessible to people with hearing disabilities. Another barrier to important public information has to do with message content. Often, there are procedures in place to ensure accessibility, but that information isn't included on the website, brochure, social media post, etc. So, a person who needs that information doesn't get it. Strategies to develop and deliver health and public health programs and services must be flexible to the needs of the community to avoid creating barriers for people with disabilities. The lack of accessible examination and medical equipment in medical care means that people with disabilities receive substandard primary care compared to people without disabilities. Lack of available sign language interpreters or alternative communication strategies provided by the health services can make it impossible for the person with a disability to understand procedures and provide consent. The COVID-19 pandemic provided an example of difficulties that can arise for people with disabilities in public health and health services. Widely accepted practices for prevention included hand washing, wearing masks, and social distancing that were crucial to prevent the spread of COVID-19. For a person whose disability requires him or her to touch in order to interact with the world, or a person who relies on personal assistance for daily functioning, social distancing can be difficult if not an impossible task. For a person who reads lips or uses sign language to communicate, wearing masks may hinder or prohibit them from being able to communicate effectively. Many people with a disability may have other health needs that may or may not be related to their disability. The more health conditions that the person has, the more difficult it can be to take preventative action or access health services. If someone uses oxygen, for example, they may find it difficult to wear protective face masks, increasing their potential exposure to contagions and being unable to enter health facilities that require masking to receive a vaccination. Another person who receives dialysis may have a harder time scheduling their vaccination at a time that works well for them. People who use a mobility device, such as a motorized wheelchair, but who also require regular medical screening for a health condition, may experience difficulty when trying to access the medical equipment. Similarly, in the efforts to address medical surge concerns during the COVID-19 pandemic, regularly scheduled diagnostic and preventative screening interventions were postponed or canceled, increasing the risk for people who rely on them to maintain their health. In situations of scarce resources, it is possible for a person with a disability who is unable to communicate their need, is in an institution, or who may have additional needs, may be deprioritized by health and medical triage practices in favor of other patients who may not need additional assistance. Practices like these greatly increase the risk and potential negative impacts on the person with additional needs. An additional barrier, beyond communication, programs, and facilities, is one related to attitude and perceptions, or also known as bias. Despite the fact that people with disabilities are a population subject to healthcare disparities, many healthcare professionals continue to see the poor health outcomes of people with disabilities as an inevitable function of disability rather than an avoidable consequence of accessibility barriers, lack of needed modifications in policies and procedures, and explicit and implicit bias among providers. Having access to health promotion and preventative services is essential for people with disabilities for improved health outcomes. People with disabilities should be included in health promotion efforts and disease prevention and management. It is not only the law, but it supports the commitment of public health professionals to ensure the reduction of health disparities. Barriers to health promoting opportunities or to getting the medical care needed results in a poorer baseline health prior to the disaster and subsequently needing additional assistance or resources immediately after or in the recovery period after a disaster. Strategies to develop and deliver health and public health programs and services must be flexible to the needs of the community to avoid creating barriers for people with disabilities. It is the responsibility of the providers to create accessible vaccine programs and health services. It is not the responsibility of the community members to navigate a system of partially accessible or inaccessible programs. Therefore, addressing barriers must be a priority for local jurisdictions. Local disability and community organizations are a valuable resource that can help to identify gaps in accessibility and inclusion, as well as feasible solutions that work for you and your local disability community. Additional trainings are available that look more closely at the types of barriers that can impact health equity for people with disabilities. This training has been brought to you by the World Institute on Disability through the support of the Centers for Disease Control and Prevention Foundation. We hope you enjoyed this video.